Hello, learners. Welcome to Lecture 24, our second session in Module 4. In the last lecture, we explored gender inequality and its impact on reproductive and child health. Today, we take the conversation forward by situating sexual and reproductive rights within the broader framework of human rights. These rights are about ensuring that every individual has the freedom, dignity, and ability to make decisions about their body, sexuality, and reproduction without discrimination, coercion, or violence. In this lecture, we will trace the evolution of reproductive rights, examining international and national frameworks, and analyze how these rights connect directly to health outcomes. Health has long been recognized as a basic human right, but sexual and reproductive health has often been neglected or politicized. Recognizing sexual and reproductive health as human right reframes the conversation from charity to justice. These rights affirm that individuals have the freedom to make informed decisions about sexuality and reproduction, which are central to human dignity. A right based approach emphasizes equity and accountability, ensuring that services are accessible to all regardless of gender, age, socioeconomic status, or marital status. Without such recognition, programs risk perpetuating discrimination and exclusion. Sexual and reproductive health rights encompass wide set of entitlements. At their core is the right to bodily autonomy, the ability to make decisions about one's own body without coercion. They include the right to access appropriate health services such as family planning, safe abortion, and maternal care. They also ensure the right to accurate information and education about sexuality. Finally, sexual and reproductive health rights affirm the right to decide freely and responsibly about marriage, family, and childbearing. These rights collectively empower individuals to live with dignity and make choices that affect their health and their futures. The concept of reproductive rights has evolved significantly over time. Initially, global discussions focused primarily on population control, with policies emphasizing fertility reduction rather than individual choice. In 1994, International Conference on Population and Development held in Cairo marked a turning point by recognizing reproductive health and rights as a central to human development. It shifted the discourse from demographic targets to individual empowerment and freedom of choice. Since then, reproductive rights have been increasingly understood as inseparable from human rights, focusing on autonomy, equity, and well being rather than mere population outcomes. Several international frameworks underpin sexual and reproductive health rights. The Universal Declaration of Human Rights in 1948 established health as a fundamental human right. The Convention on the Elimination of All Forms of Discrimination Against Women in 1979 explicitly linked women's rights with health and equity. The ICPD Program of Action in 1994 firmly placed SRHR at the center of development agendas. More recently, the Sustainable Development Goals in 2015 reaffirmed commitments to universal access to sexual and reproductive health services under Goal number 3 and gender equality under Goal number 5. Together, these frameworks form the backbone of global advocacy for SRHR. In India, several national frameworks support sexual and reproductive health rights. The National Health Policy 2017 emphasizes universal access to reproductive and maternal health services. Programs like RCH and RMNCH plus A aim to integrate reproductive, maternal, newborn, child, and adolescent health. The Medical Termination of Pregnancy Act provides the legal framework for safe abortion through certain restrictions. The Protection of Children from Sexual Offences Act ensures protection of minors, though its intersection with adolescent reproductive rights remains debated. Together, these frameworks recognize India's recognition of sexual rights as central to public health, though challenges in implementation still persist. The core principles of sexual and reproductive health rights align closely with the foundations of human rights. Autonomy ensures individuals have control over their bodies and reproductive decisions. Equality and non discrimination guarantee that services are available to all without bias on the basis of gender, age, caste, or marital status. Informed choice means individuals must have access to accurate information and services to make voluntary decisions. Accountability requires governments and providers to respect, protect, and fulfill these rights. Without these principles, reproductive health programs risk violating rather than protecting rights. The right to contraception is the cornerstone of these rights. It means that individuals and couples should have access to a wide range of safe and effective contraceptive methods that suit their needs. Informed counseling must accompany services, ensuring clients understand the benefits, risks, and side effects. Crucially, the right to contraception includes freedom from coercion, neither forced sterilization nor denial of contraception should ever occur. Ensuring access to voluntary and informed family planning not only protects rights but also contributes to maternal health, gender equality, and broader development goals. Safe motherhood is a fundamental right. Every woman has the right to skilled care during pregnancy, childbirth, and postpartum. This includes access to emergency obstetric services such as cesarean sections and blood transfusions when needed. Now, respectful maternity care is also a part of this right, meaning women must be treated with dignity, privacy, and compassion in health facilities. Denying safe motherhood services is a violation of human rights, as maternal deaths are largely preventable. Recognizing this right ensures that maternal health is not just a medical issue but a matter of justice and equity. The right to safe abortion is integral to reproductive rights, yet, it remains contentious. In India, abortion is legal under the Medical Termination of Pregnancy Act, with amendments expanding access up to 24 weeks in certain cases. Despite this legal framework, many women still face barriers such as stigma, lack of trained providers, and misinformation. As a result, unsafe abortions continue to contribute significantly to maternal morbidity and mortality. Ensuring the right to safe abortion requires expanding services, training providers, combating stigma, and empowering women with knowledge and autonomy. Information and education are critical components of these rights. Comprehensive sexuality education equips young people with knowledge about their bodies, relationships, and contraception along with consent. This empowers them to make safe and informed choice and decisions. Access to accurate health information is equally vital for adults, enabling them to understand risks, rights, and available services. When information is denied or distorted, individuals are deprived of the ability to exercise their autonomy. Recognizing the right to information is therefore a cornerstone for realizing Other sexual and reproductive health rights. Sexual autonomy means individuals have the right to decide freely about their sexuality and relationships. This includes the right to consent, the right to refuse, and the right to freedom from violence and coercion. It also means respecting diverse sexual orientations and gender identities. Denying sexual autonomy through practices like child marriage, marital rape, or criminalization of consensual relationships is a violation of human rights. Recognizing sexual autonomy affirms the dignity of individuals and strengthens the foundation of healthy societies. Adolescents face unique challenges in realizing their sexual and reproductive rights. They are often denied access to contraceptives, safe abortion, or even accurate information due to social stigma or restrictive laws. Confidentiality is particularly critical as fear of disclosure can prevent them from utilization of services. Youth friendly policies and services that respect autonomy, privacy, and rights are essential to protect adolescent health. Recognizing adolescents as rights bearing individuals rather than passive dependents is crucial for advancing of the rights in this age group. Sexual and reproductive human rights and gender equality are deeply interconnected. Women's empowerment directly improves reproductive health outcomes, as empowered women are more likely to use contraception, access antenatal care, and make informed health choices. Conversely, restrictive gender norms limit women's autonomy and reinforce inequality. Ensuring sexual and reproductive health rights is therefore not just a health issue but a pathway to gender equity. Recognizing this interlinkage is essential for designing holistic interventions that promote both health and social justice. Despite recognition in global and national frameworks, sexual and reproductive health rights remain difficult to realize fully due to persistent barriers. Stigma and discrimination around sexuality, abortion, and contraception discourages individuals from seeking care. Weak health system with limited infrastructure, supplies, and trained staff further restricts their access. Legal and policy restrictions such as parental consent requirements for adolescents or criminalization of same-sex relations create additional obstacles. These barriers must be systematically dismantled if these rights are to be realized as universal human rights. Violations of these rights is not hypothetical, they are real and ongoing. Cases of forced sterilization, often targeting marginalized women, have been documented in several countries. Denial of abortion services, even when legal, drives women towards unsafe procedures. Gender based violence, including sexual assault and intimate partner violence, undermines women's reproductive autonomy and health. These violations demonstrate why reproductive rights must be treated as human rights because they are about protecting individuals from abuse, coercion, and harm in the most intimate aspects of their lives. These rights are integral to Sustainable Development Goals. SDG 3, which aims to ensure healthy lives and promote well being, while SDG number 5 calls for gender equality and empowerment of all women and girls. Without universal access to reproductive health services, these goals cannot be achieved. Moreover, progress on these sexual rights as human rights contributes to education, poverty reduction, and socio-economic progress. A right based approach ensures that progress is equitable and sustainable, addressing root cause of exclusion rather than providing temporary solutions. So these rights are thus foundational to the entire 2030 developmental agenda. Health systems play a central role in translating these rights into practice. Accessibility means not only physical proximity but also affordability and cultural sensitivity. Providers must be trained to deliver rights based care, which respects autonomy, dignity, and confidentiality. Accountability mechanisms such as grievance redressal systems, audits, and community monitoring ensure that violations are addressed and rights are protected. Strengthening health systems through a rights lens is therefore a critical step towards realizing sexual and reproductive health rights as human rights. Communities are vital actors in advancing sexual health and rights as human rights. Awareness and empowerment initiatives helps individuals understand their rights and demand services. Social accountability tools such as community monitoring and public hearings ensure that health services are responsive and are equitable. Community based organizations and NGOs often play leading roles in reaching marginalized populations, challenging harmful norms, and providing services. By engaging communities, these rights become more than policies, they become lived realities that people can claim and exercise. India has made efforts to address adolescent rights as human rights through initiatives like ARSH, that is Adolescent and Reproductive Sexual Health Strategy, and Rashtriya Kishore Swasthya Karyakram. These programs aim to provide adolescent friendly services, counseling, and education. However, implementation challenges remain, including inadequate provider training, stigma, and lack of confidentiality. Adolescents continue to face barriers in accessing contraception, safe abortions, and sexuality education. Strengthening these initiatives with a stronger rights based focus is critical to safeguarding the SRHR of India's youth. SRHR and HIV/AIDS are closely linked. Protecting sexual rights, including the right to safe sex and freedom from coercion, is central to preventing HIV transmission. Access to testing, counseling, and treatment services is essential to managing HIV as a chronic condition. Yet, stigma and discrimination remain major barriers, deterring individuals from seeking care. Addressing HIV/AIDS through the SRHR framework emphasizes dignity, autonomy, and equality, ensuring that prevention and treatment strategies are both effective and rights based. Marginalized groups often face compounded barriers in realizing SRHR. LGBTQ plus individuals encounter legal, social, and cultural discrimination that restricts their access to health services. People with disabilities face physical barriers as well as assumptions that deny their sexuality and reproductive rights. Intersectional discrimination means those who belong to multiple marginalized groups, such as poor disabled women, are especially vulnerable. Recognizing and addressing the SRHR of marginalized populations is essential to achieving true universality and equity in health rights. The practice of SRHR involves complex ethical questions. Balancing individual autonomy with cultural sensitivity can be challenging, particularly in societies with strong traditional norms. Informed consent is central. No procedure, whether it is contraception, abortion, or sterilization, should occur without consent. Protecting vulnerable populations, including adolescents, refugees, and those in poverty, requires careful attention to ensure rights are not violated in the name of public health or cultural practices. Ethical frameworks must guide the design and implementation of SRHR programs. Law plays a critical role in shaping SRHR. Progressive legal frameworks, such as those guaranteeing access to abortion or outlawing child marriage, enable rights. Conversely, restrictive laws, such as criminalizing same sex relations or requiring spousal consent for contraception, undermine them. Legal literacy among communities and providers is equally important as many are unaware of the rights already guaranteed by law. Future progress in SRHR requires not only enacting progressive laws but also ensuring that people know, claim, and exercise their rights under these laws. International advocacy has been instrumental in advancing SRHR. UN agencies such as UNFPA and WHO promote guidelines, provide resources, and monitor progress. Civil society organizations at the global level lobby for stronger commitments and hold governments accountable. International forums provide platforms for sharing best practices and lessons learned across countries. This global solidarity strengthens national efforts, ensuring that SRHR remain high on policy agendas worldwide and that countries learn from each other's innovations and challenges. Measuring progress in SRHR is essential for accountability. Indicators may include contraceptive prevalence, unmet need for family planning, maternal mortality, adolescent birth rate, and access to safe abortions. Collecting disaggregating data by gender, age, socioeconomic status, and geography helps identify inequalities. Monitoring must go beyond counting numbers to include quality and experience of care. Linking monitoring to accountability mechanisms ensure that data leads to action, not just reporting. Progress in SRHR must be measured not only by outcomes but also by equity and rights. The future of SRHR lies in integration, expansion, and innovation. Integrating SRHR to universal health coverage frameworks ensures that reproductive health is not left behind in the push for health system reform. Expanding adolescent friendly services recognizes the centrality of young people to future health outcomes. Embracing digital health solutions can enhance access, education, and monitoring. These directions must be pursued within a right based framework that ensures equity, autonomy, and dignity for all individuals. Key takeaways for today to summarize: sexual and reproductive health rights are not optional benefits. They are fundamental human rights that must be respected, protected, and fulfilled by governments and societies. The core principles of equity, equality, autonomy, informed choice, and accountability provide the framework for these rights. Yet, in practice, barriers persist. Restrictive laws, weak health systems, social stigma, and entrenched gender norms continue to deny the individuals their rights. Overcoming these barriers requires sustained advocacy, stronger systems, and cultural transformation. These takeaways remind us that health outcomes and human rights are inseparable. In conclusion, sexual and reproductive right health. In conclusion, sexual and reproductive health rights embody the intersection of health, dignity, and equality. Without them, the broader vision of human rights remains incomplete. These rights protect individuals' ability to make free and informed choices about their bodies and their lives. Recognizing them is not only a matter of justice but also a proven pathway to better health outcomes, stronger families, and more equitable societies. A future health professional and policymakers, you have the responsibility to safeguard these rights and ensure they are realized in practice, not just on paper. As we close this lecture, I will try to reflect on the profound statement that reproductive rights are human rights. This means that denying someone's access to contraceptive, safe abortion, and respect for maternity care is not just a health failure, but a violation of fundamental human right and their freedom. Protecting these rights ensure that every person can live with dignity and make choices about their body and life. Moving forward, we must integrate these rights perspectives into policy, service delivery, and education. Moving forward, we must integrate this rights based perspective into policy, service delivery, and education. Only then can we build a future where reproductive health and human rights are inseparable realities for all. This is all for this session. Next on, we move to lecture 25 on legal aspects of reproductive health. Thank you.